Choosing a long-term care facility can be overwhelming, but the difference between helping your family and draining your family's savings can move faster than you think. Today, we're going to cover the hidden financial risks and why expert help is key to protecting your loved ones. Welcome back to Health and Retirement, everybody. I'm Kimberly Sixkiller, Chief Insurance Officer for Market Advisory Group. And today, I'm joined with John Weber. He's the owner of Senior Care and Senior Care Advisor for Assisted Living Locators. Welcome, John.
Thank you. Good to be here.
Yeah, we're glad to have you. So I know that you've spent your entire career in human resources in the last 25 years, and then you were able to get involved and purchase into Assisted Living Locators. Tell us a little bit about getting involved.
Well, basically, from a standpoint, it all started with my family. I was the director of the downtown YMCA here in Wichita, and my father had a stroke, and so he was having a lot of issues that I had to go down and help my mom with. And at the same time, my uncle and aunt, who had no children and no other family, started having issues as well. So I ended up having to take some time off work, and it got to the point where I saw that I was going to need even more time. So that's when I decided to quit my job and go down and see what I can do to get everything taken care of. And that includes talking to their wealth management people, getting involved with all the homes they sold. They had in Arizona, the house in Salina, they had the cars, they had all these different things that I had to figure out because they were no longer going to be able to stay at home and drive anymore once I found this out. So it took me about 2 years to get everything worked out. My uncle and aunt didn't do anything with their power of attorneys, they didn't do anything with their wealth. It was all just kind of open, so I had to structure all that. And I could have used a lot of help. So after I did all that, I started looking to see what opportunities were out there. And this franchise came up, Assisted Living Locators. It was started by a nurse in Phoenix. And I bought the franchise, long story short, and have been helping people ever since for about 7 years. It kind of started more as a mission statement, but now I do it full time. I have two guys that are helping me out now, Steve Green and Brett Gaffney, and we're just trying to help as many people as we can at this time. So
that's really cool. We love your team. That what you guys do is so necessary. And the sad thing is, you're talking about I had to do this. It took 2 years. I had to quit my job. That's not really an uncommon, if you don't have help with something like this, it can really take over your life. I mean, how many people do you help every day that they would just be lost?
Yeah, I mean, just about everybody I talk to, there's something that they haven't done or they haven't looked at, or so it's just consulting, sitting down with families, looking at their financial picture and letting them know, hey, you need to go talk with your wealth management group, hopefully you.
We appreciate that.
But also elder care lawyer. Do they need that? Do they need assistance with home health? Do they know about Medicaid and Medicare and all those different aspects that come up? And we try to help them weed through that and come up with, if we don't know the answer, we'll find professionals that can help them get those answers and hopefully find the right solution for that family.
And it's really cool. I was talking to Brett, one of your individuals that works with the ALL with you, and what you haven't mentioned yet is, in addition to helping them figure out which homes might make sense, you actually go on the tours with them, right? So
Absolutely.
Help them, because we kind of that phrase, you don't know what you don't know. Can you
Right.
kind of talk about how that works?
Well, once we kind of find out what the family needs, and it could be just they could do something at home or bring in family if they're lucky enough to have family could do that, and with the help of home health or home care, if it does result in they need to look at other options, that's where we can come in to talk to them about independent living, assisted living. Do they need memory care? Is it going to look like more skilled? So we can help determine all those different aspects of what the solution may be. The cost can be anywhere from, I'd say, $1,500 to $2,000 to $3,000 for independent living. Then when you get into assisted living, you're looking at $4,000 to $7,000 depending on level of care needs. Then you get into memory care, you're looking at $7,000 to $9,000. And then skilled nursing goes from $9,000 to $12,000 in this area. That's kind of typical nationwide as well. So.
Yeah, it definitely, the cost of long-term care can be staggering, and the further burden of not planning is just even worse on the family. And I think what's really cool about you all is what people don't realize, and I like to really point out, is from a standpoint of being the client that you're helping, Assisted Living Locators doesn't charge me anything. What you're doing for them is paid in other ways, right?
Right. We are paid by the community itself, and we evaluate the communities before we decide we're going to do an agreement with them. But they typically would pay us a referral fee for finding the right family for them, and hopefully the family gets a good deal out of that as well. There is no cost at all to what we provide to the families, so that helps the family. It helps the different providers that they're looking at through that whole process. So.
To kick things off on today's episode with our first segment, In the Know, we have our guest in the office, John Weber, and I can think of no better time than now to dig into the hidden pitfalls of selecting your own nursing home facilities and long-term care facilities. So let's set the stage. John, we kind of talked about that long-term care is one of the biggest expenses that families can face. In those cases, people are obviously just unimaginably oblivious to what is coming and what's involved with selecting a home. Until you've dealt with it, you don't know what you don't know. So talk to me a little bit about maybe some of those hidden dangers and those minds that you're trying to help them navigate.
Well, once we look at kind of what options are out there that's going to meet their needs, you've got to look at one thing that could really hurt is if you pick a community that does not accept Medicaid. And if they don't accept Medicaid, then you're eventually going to get kicked out if your finances run out. So we try to help look at that. We can find communities that accept that. You want to make sure that what time frame, some of them are a year to 2 years to 3 years of private pay before they will accept HCBS, home-based community service for Medicaid. So we help determine that. We take them on the tours again. If we're successful in getting that right place for them, they need to make sure that they get their paperwork done and they know all the different ins and outs of what that place provides. Mm-hmm. And once you know that, then you get to sign off on that paperwork that you understand everything that goes into that. Because there's a lot of times people they're so ready to get their family into a place, they don't really go through the whole paperwork process and really understand it. So that can be a pitfall there that they could get into.
I think that's what the partnership between Assisted Living Locators and Market Advisory Group, why it fits so well, is we always tell our clients, you never have to go it alone, right? And so you're really helping them at such a emotional point in their lives to say, okay, we still have to cross these T's. We still have to dot these I's. Have we looked at this? Because like you said, something as simple as, does the nursing home accept Medicaid as a payment option? If they don't, and you don't have a really great financial plan ready, you're going to be doing this again in a couple years potentially. So,
and it's an emotional time,
absolutely.
And so you don't have all those things that you need to understand. That's why you need help of a professional, whether it's wealth management, whether it's an elder care lawyer, whether it's somebody like myself that helps them find the right place.
Yep. And so one of the things that you mentioned was with nursing homes, they have their base rate, but then they have their additional fees and the additional costs that are associated that really encompass what you're going to pay monthly. How often do you see maybe where clients don't truly understand the full monthly cost that's going into it?
So when you look at independent living, that's typically just going to be a rent, the cost of the room, and there really is no other services. Now, some of them will provide 3 meals, some of them just 2 meals. Sometimes you can just do add-on meals if you cook for yourself. So those are for independent living. Those are things you want to look at. When you get into assisted living, that's where they're going to have a rent plus level of care. So they're going to come back and do an evaluation on your loved one and determine what all do they need help with. And then they're going to add on extra costs, whether it's medication management, whether it's they've got to change out diabetes for, whether it's pills or injection, all those could add additional costs. So you want to fully understand what those level of care costs are on top of the rent. Sometimes they go into that very well with you, sometimes they don't. Sometimes you get shocked when they come back with the overall price per month. So you want to be sure what they provide and what those costs are.
Perfect. So really, to sum that up, that first full financial pitfall is truly understanding the package, the financial package, and that means trust but verify. Do they accept the insurances that I have? Do they allow for Medicaid as an insurance? Correct. And what will that budget be, and does it cover everything I need? So as we're talking about these different pitfalls, right, we're talking about these different hidden dangers. The next thing that I think that people don't realize is that you want to make sure that based on your family member's diagnosis, there may be a plan of care that means switching different facilities, right? So dementia and Alzheimer's is one that comes to mind first. How do you kind of help coach a client through that as they're selecting a care unit and saying, maybe we need to look at a planned unit that we can move floors and not have to move across town?
Right. So if you're looking for a community, it's called continuing care community, which has everything. You start with independent living, then you go to assisted, then you can go to memory care if needed, and they also usually have a skilled nursing component. Those can be very expensive. You're going to have to probably move to another building one way or another. So I do try to tell people that, you know, you don't have to be in a full suite of every option on campus. Because especially when you go into independent living in those kind of facilities, you're laying out a huge down payment, and then you're getting a monthly cost still, where there are other ones that are just 30-day contracts and you can get out within 30 days. So I try to walk the family through those different types of communities. And if they do need to move on from an assisted to memory care, then you're still going to be switching, so sometimes it's not. Now, it may be tough and may be further away, but still the options are out there for that.
And if there's not a continued care available, they can always go back to assisted living and say, hey, John, we got to move my dad.
Right.
We're in a different situation. You're going to jump in and help him again and help place him again.
Right.
Awesome. I think that there's really that encouragement that at the end of the day, it's about don't go it alone. Just like we always say here at Market Advisory Group, you want those professionals, regardless of that area of life that you're looking at, there for you. And this is just another one of those places where someone's going to help you. If you want to stay in the know with all things healthcare insurance, or perhaps have a professional review of your policies, give us a call at 1-833-MAG-REPORT. That's 833-624-7376. Or you can email us at maglife@marketadvisorygroup.com and connect with us today. All right, so John, for this next segment, I really want to dig into specific client cases that you've been able to help. So here at Market Advisory Group, we work with a lot of people, typically ranging age 60 to 85 on their retirement planning and that long-term care, healthcare, Medicare planning. And I know that you get to work with a lot of their family members on how do we make this placement. So can you maybe tell me about a client that you're working on helping to place right now, and kind of how you're navigating that search and getting them the right facility?
Yeah, one recently, we're dealing with a son that's out of state, and both parents are here in Wichita, and he found out, recently that his father went into rehab, had a fall, and is going through some tough things there. The mother was at home, and she was also having issues as well. The father was kind of taking care of her, and now it's going to be reversed. And now she's got to take it all, and she's very limited on what she can do. So he asked me to go visit with the mother and find out exactly what the needs were. And I found out she was very much debilitated at home and couldn't leave, didn't have any other family. So I started talking to her about how we could get, once her husband was done with rehab, how we could maybe try to find an assisted living community that would accept both of them in a 2-bedroom or 1-bedroom, depending on, again, what they can afford. And it was very tough because you had one that's getting out of rehab, the other one was trying to figure out what to even do. They had a home to sell. That was the only way they could probably afford something. Eventually they had enough money to maybe last a couple months for the rent and the care, And then after that, they're going to have the sale of the home. So I had to navigate with all of that with the son, help them get paperwork. They didn't have any power of attorney. They didn't have a lot of that done. So I helped get that all negotiated, get the son down here to sign everything. And we did find a place that was a smaller community outside of Wichita that was able to accept them. So we went through that whole process. And I don't think she would have been able to even come close to getting all that done without a provider to come in and do that.
Or without the son, then, it becomes very cyclical of your story of the son having to come home and help you.
And the son didn't really have any idea what was going on because he couldn't see the mother. The mother would always say she's okay, but she was not. So I had to kind of intervene there to let him know it's a little bit more serious than you think and you need to get back.
Absolutely. I think that that's an important thing people to think about as well. We have people, nationwide who may catch our podcast, may hear it, go to see it on YouTube. They may not be here, but they may have family members who are. And so this is really that extension of the family to help with what they need. If you have any questions that you want us to focus on the show, or if you have a case that you'd like us to explore, write us on our email at maglife@marketadvisorygroup.com. We'll be sure to give us your name and city so we can shout out to you on the show. And as always, you can give us a call and schedule a meeting so we can help you with your situations. Because if there's one thing I know, no two people have the same health and retirement needs. All right, well, that brings us to the final segment today, and that's our mailbag segment. And so this is where we take questions from viewers just like you and answer them here on the show. Today's question comes from Everett in Manhattan, Kansas. Everett asks, we love the facility that we found for our dad, but we're worried we'll run out of money and that he's going to be kicked out because they have no Medicaid spots available. They do accept Medicaid. What can we do? Help. John, well, I think that's interesting. He knows they accept Medicaid and they've already been there. What can we do about this for Everett?
Well, what I would do with Everett is again go find out all the needs again that they have, and then start looking at other options that are in the area and see with it and find out again is it going to be Medicaid pending? Is it going to be Medicaid right off the bat? Do they have any kind of funds left to at least pay for 1 month, 2 months, 3 months? Try to find that information out and then find a facility that would accept him and has an open room available for
because
that.
The reality is, and you kind of spoke to this before, it's scary and it's kind of that, it's a really scary unknown, but there's only about 6 reasons that they can just kick someone out of a nursing room, right? They can't just throw him out because they don't have a Medicaid bed, but he's going to Medicaid, correct?
Yeah, they don't have to, they cannot kick him out until he has enough time to find another location that could accept that. And that's where having a professional come in and help and say that I'm using somebody to help me find another place, then that will give them an extension and they won't try to push you out as much, as long as they know you're trying.
And talk to us through there are certain, like you said, prerequisite timelines that if you have been in a situation where you've been paying cash or with long-term care for 2, 3, 5 years, does that change their ability to then kick you out because you have to go on Medicaid, or how does that rule work?
And that's why you need up front is figure out, are they going to accept it eventually after you've spent, a certain period of time? And they have to tell you that up front. And if they don't, then you've got something you can work with. But you need to find that out. If that, some of them just do not accept it. They don't have Medicaid beds available, or it could be all their Medicaid beds are filled at the moment and they need to move you on. So that's where a professional again can come in and help read that through, but they can't just kick somebody out until that.
So we don't know, Everett, obviously, your dad's story, but if we were to assume maybe, let's say, Everett told us he's in Manhattan, Kansas, let's say that they did tell him, hey, we accept Medicaid, you have to be here for 2 years, and his dad's been there for 3 years, then is it on the nursing home that eventually when the bed opens, his dad gets it, or can they say, oh, we don't have a bed? How does that work?
Well, I mean, if they told that they have a bed available, they need to make one available. So, they just can't kick them out. So,
okay.
Yeah,
so
should be all right.
Like you said, having that professional behind to really, knowledge is power, just like we would want to have a lawyer with us in the courtroom. We are a realtor when we're buying a house. you're there for them to help them with figuring out their long-term care needs, and that's awesome.
And if it comes to a law type deal, then I'll give them, if they don't know anybody, then I'll get them in front of somebody that can. So
excellent. That's it for today. Be sure to subscribe and stay tuned for more videos just like this one for all of your health and retirement needs. Don't forget to like or share so that we can help your friends and family by getting them the information they need to make the right choices for their future of their combined health and wealth. You can catch our show and our entire catalog of shows out on our channel, youtube.com/@retirementhelp, where we archive all our previously recorded and aired shows with our professionals from healthcare to financial to estate and tax sectors as well. All of us coming together in one place to talk about how we're actively working with clients today to prepare them to live their best lives in retirement. I've been your host, Kimberly Sixkiller, and thanking our guest again, John Weber with Assisted Living Locators, for joining us here on Health and Retirement. We'll see you next time.
Investment advisory services are duly offered through Foundations Investment Advisors LLC, an SEC-registered investment advisor, and Market Investment Group LLC, an SEC-registered investment advisor. The investment advisor representatives of Market are also affiliated with and registered through Foundations Investment Advisors LLC, and may provide services on behalf of both firms to client or prospective clients where properly licensed or exempt. This show is presented by Market Investment Group LLC, an SEC-registered investment advisor that only conducts business in jurisdictions where it is properly registered or is excluded or exempted from registration requirements. Registration as an investment advisor is not an endorsement of the firm by securities regulators and does not mean that the advisor has achieved a specific level of skill or ability. All expressions of opinion reflect the judgment of the presenter on the date of the show's publication and are subject to change. Annuity and life insurance guarantees are subject to the claims paying ability of the issuing insurance company. If you withdraw money from or surrender your contract within a certain time after investing, the insurance company may assess a surrender charge. Withdrawals may be subject to tax penalties and income taxes. Persons selling annuities and other insurance products receive compensation for these transactions. These commissions are separate and distinct from fees charged for advisory services. Insurance products also contain additional fees and expenses. All client or prospective client names have been changed to protect the identities of the individuals discussed. All rights reserved.